Hi, everybody. Dr. Jake here. And today I'm going to talk about corticosteroid shots versus shockwave therapy. And this is important because some of you might be in this realm of trying to figure out which direction to go. You have a pain in your shoulder, your knee, that's been progressively getting worse, maybe chronic, and the doctor offers you a potential solution with a steroid shot. And it can be effective. There's people that take it and pain's eliminated for a little bit of time. But it's important to know what you're getting into. So I'm going to go into the research and first of all, just talk about, let's say, the side effects. So the side effects of corticosteroids is it's going to decrease cartilage, is going to atrophy ligaments and tendons over time, and decrease bone density, advance arthritis, and so it's pushing you into a weaker joint. And this concludes, especially after multiple, they become more effective over time. Where shockwave therapy, what it's doing is setting an environment for healing. And so that's going to create new blood vessels. It's called neoangiogenesis. And so new capillaries into the area, which will bring nutrients that's needed to repair the joint. There's going to be recruiting of the stem cells and the fibroblast cells, which is the repair team. So the tissues are going to remodel at a faster rate. And it's also going to break up any scar tissue, adhesion, so it allows for greater range of motion. And I'm using research to back this up. There's a number of studies that have been concluded looking at corticosteroid injections versus shockwave therapy. And one of which was 2009, they did a study on hip pain and looking at the two along with home therapy equipment or home therapy exercises. And what they found, and I'm going to read just the conclusion right off the deal, is that the role of corticosteroid injections for greater trochanter pain, which is hip pain, needs to be reconsidered. Subjects should be properly informed about the advantages and disadvantages of the treatment options, including economic burden. The significant short-term superiority of a single corticosteroid shot injection over home training and shockwave therapy declined after 1 month. Both corticosteroid injections and home training were significantly less effective than was the shockwave therapy at 4-month follow-up. Corticosteroid injections was significantly less successful than the home training and shockwave therapy at 15-month follow-up. And so the corticosteroids with knowing of the side effects only had about a month span before the results started to decline, where shockwave therapy actually increased in results over time. There's another study, as a meta-analysis study of 2018, looking at plantar fasciitis using randomized controlled trials. And so meta-analysis analysis uses a number of different quality studies and then looks at those results and comes up with a conclusion. And what they found is, again, shockwave therapy was incredibly more effective after the 3-month follow-up, where they were equal in results after a month. And the last one was a systemic review, another meta-analysis study of looking at knee pain. And what they found was the same thing. After 3-4 months, improvements occurred. Not only that, but larger range of motion and quality of life was improved as well. And the reason that is because it takes time to remodel tissues and bring in blood flow. So even though you do have an analgesic effect right off the bat with shockwave therapy, you're continually get improvements. And so it's letting the body figure out how to resolve its issue itself. So it falls right in line with the philosophy of what we do. And so if you do have any additional questions, ask your doctors. We're here for, education and advice. We feel that you make better decisions if you're well educated. And so we're not here to direct you in one area or not, but just educate you and let you know if you have questions. Additionally, find us. We're happy to help. All right, guys. Have a wonderful day.